Hi, everybody. Again, an honor and a pleasure to be here, and awe-inspired, I guess, by our previous speakers. Really thrilled to hear that a company such as Novartis has put such an amazing program together. It has been my experience for many, many years as a migraine sufferer myself in the workplace that it is only with such conscious support of staff that we can actually address the challenges that migraine sufferers really face in the workplace. And if I can take myself back a couple of companies ago, where I was a manager, but I guess one of the things that we have to respect is the fact that, many of our speakers, Mary talked about courage, um, and Leo talked about empowerment. That's something that hasn't really been very easy for migraine sufferers in the workplace. You have to be able to, in the current or in the past Irish environment, very much be that courageous person, stand up for yourself, speak out, to be able to even access minor accommodations. So if I take myself as an example, working in a financial service organization in a shared office space, that shared office space has many, many potential triggers. And I think Mary alluded to the fact that the triggers aren't just one event, they can be a combination of things. So let's say it was a long day the day before, it was kind of stressful in work, and the next day you're in the office, you're already heading toward a migraine and the lighting affects you. So for me, for example, I'm incredibly photosensitive. It's primarily fluorescent type lighting, LED type lighting. So even in the more modern offices where we're no longer dependent upon fluorescent lighting, we've got this super bright LED light, and it's environmentally fantastic from a climate change and a cost perspective. But from a migraine perspective, for me, it was hell on earth. Incredibly severe pain, like putting an axe down one side of my head through my eye. So the accommodation that I sought, I'd simply had a chat with my management and I said, look, is it possible to sit me somewhere where I'm not affecting anybody else around me, but that you could turn the light off over my head, that one little lighting unit, or sit me away from it. So can you please find a darker corner for me, in other words? And I was really lucky. They listened, they understood, they helped, and that reduced the opportunity for those escalations, that increased degree of triggers to build for me. Now, I carried that experience with me. I was lucky. Again, I'm not the shyest person on earth. So it meant that when I went to my next organization, who had that ultra modern office, super bright, reflective surfaces, white desks, that I was able to say, this environment physically hurts me when I walk into it. Another element that Mary's diagram of the office and the potential triggers in the office might have covered would be patterns. So patterns, severe patterns on the wall, maybe an installation that looks lovely from an art perspective but has close patterns in it, or even carpets can be one of those accumulative triggers that cause people pain and build into a migraine. So it's amazing how, as time progresses, you learn as a sufferer what are your kind of danger points. Modern lighting in cafes, those lovely modern bulbs, clear bulbs where you can see the element inside, I can't look at. Now, again, because I'm fortunate that I'm a bit outspoken at times, I would have turned to my colleagues at the time and said, look, guys, can we move somewhere else? Can we eat in a corner of the cafeteria that's darker or quieter? Can we go out for coffee? And in fact, in the end, they actually learned what were my triggers, and they would get there ahead of me and pick a table that we could sit at where I would be looking outward, perhaps into the daylight rather than inward into the bright light of a cafe, and so on. And I guess that's ultimately the lesson I took with me from organization to organization, is that if I was brave, if I could take that first step, if I could open the door a little bit, that I could be supported very much in a natural way by most people. So, those who are unable or feel lack of confidence in actually sharing their story, their colleagues, as we've just pointed out in a number of different points, don't know, can't help, don't understand. And the return as an individual of you taking that brave step is fantastic. You get that understanding more so with your team, your management, and so on. And I guess that's my experience. The current company I worked for, the minute I did an interview with them, I said, by the way, just to let you know, I have migraine. It's chronic. It's more than 15 days a month. I manage really well. I probably suffer quite a lot from presenteeism, actually, now that I come to think of it. But at the time, wasn't familiar with the word. I said, if you can help me, if you can help me identify the right environment, the best environment in the office, I'll be able to be more comfortable, I'll have less migraine, it'll impact my work less. And they were amazing. Before I even started, they brought me to where they felt, they'd looked at the office layout, where they felt would be the best place for me, beside a big open window. They had showed me how they were going to move the light fitting away from me. It wouldn't interfere with anybody in my immediate location. We talked about that point that I think Mary raised earlier on about having a restroom. So they brought me to the first aid room and they asked, would this work for you when you need to take your medication? Can you move in here? And so on. And it was fantastic. I really felt that I could bring my talent to that organization. They could value me in a way that perhaps others might not have really been able to do in the past. And that understanding has built over the years. It is, however, in Ireland, very much so that the individual is the brave one. The individual is the one that stands up. And that's why the Novartis program that Leo's just talked us through is phenomenal. It's that safe environment we always want to work in. We want to bring our whole self to work. We want to be open about the challenges we face and not feel that people are judging us, that we will be stigmatized as a consequence of something that people do not understand. And migraine isn't just a headache. It is a phenomenal experience. It is so bad, so painful, so prolonged. As said, more than 15 days a month for me. And you heard at the introduction that my family, I'm fourth generation, fifth generation. One of my children, my daughter, who's 26, has lost 8 years of her life to new daily persistent headaches. She's fully disabled. So we don't want people to single us out particularly, but minor accommodations can really bring us into the family that is an office environment or a professional environment, somewhere we can bring our whole selves, as I said, to work. It's really important from a diversity and inclusion perspective. I, as the bio kind of led to, I'm a manager as well. I have my own team. In my team, we have a very stressful role, business resilience, especially at the moment. Everybody knows what we do. Everybody understands the terminology about R numbers and working from home and that social distancing, all the terminologies that we've been trying to help everybody understand for many years. But it's a highly stressful environment to manage that situation on behalf of a business, to help them through it. We help them plan for it. We now help them implement it and action it. And so that 7 staff are covering 16 locations, all having COVID-19 responses at different rates, all highly stressed. But they all understand migraine. 3 of the members have it. We are open about it. We talk about it. We say, look, guys, can you take over for a period? I need to go and take my medication. I'll let you know if I can't come back. And we're very supportive of one another. So I think, again, I, as a manager, have an obligation, duty of care to my staff to make sure that that environment is available to them as well. And I guess it's really important that they feel that they don't have to be that presenteeism person. They don't have to work their way through it. That they will be accommodated if they need to take that break with understanding and compassion. And I think that's hugely important. So I'm kind of looking here at my notes. What else did I do? And again, it's not all about just me as the manager, but me as a sufferer as well, raising awareness. So I work with Migraine Ireland as much as I can to help advocate. I bring that into the workplace. Every one of my last three employment teams, we have actually brought Migraine Ireland in. They've helped us run awareness sessions. I run awareness sessions on my own as well. I'm practiced at it. I can do that now. It's easier. And we bring people to sessions where they get to understand what migraine is about. They get to talk to one another and build a network. They can then self-support more. they can share the frustrations, the anxieties, the pain that they suffer. They can discuss what it's like to be a parent who has a child at home with migraine. So it's not just the employee who has migraine in the office, but it's those who, we now know there's such a prevalence, 500 or 700,000 in Ireland. Everybody probably knows somebody with migraine and may have to be a carer if they're not an actual sufferer. So, you know, having that capability of helping them understand and fulfill that need and be more empowered. I think Leo mentioned that quite a lot. Empowerment, I think, is hugely valid. What we did in my organizations is we used material that pamphlet that, or the infographic that Leo showed on migraine at work. I actually was part of the focus group that developed that with Novartis in Ireland. And it was thrilling. It was a pleasure to see somebody interested in actually helping raise that awareness. So that's in all of the offices that I support at the moment. We have a day a year, which is on the 21st of June, which is around migraine awareness. And it's wearing a shade on the longest day of the year in the Northern Hemisphere from a lighting perspective, just to draw attention to why would a person in work maybe have a pair of sunglasses on or a peaked hat. It's to understand that they're trying to shade themselves from light, and maybe we could all understand that a little bit better and help them. I've set up a page on our intranet site, which is a community page where people can network and share their own stories, a little bit of a blog. You know, I post links to interesting information as I find it. Hopefully, if I can post the link to this afterwards, that will help somebody else. But it's all a matter of creating that self-aware environment for the staff member not to have to be so brave, but to be safe, feel safe and empowered to come forward, talk about their condition, which is highly complex. And to Leo's point, that return, not just a return on investment, but that return in empowering a talent base and wanting to stay with your organization because you understand them and they feel valued. I can only tell you that from a one-to-one perspective, when I get an organization to understand me and my situation, it makes me really proud of who they are and what they do, because I can say, wow, this is what my organization has done for me. And I guess that's really as much as I can say for now, unless anybody has questions for me later. Mary.
Claire, thank you so much. I'm in awe of you. I've heard you speak several times. You bring so much compassion and courage. And I guess maybe one of the questions that comes to me is, again, it's a difficult question to answer. But how do you start building that courage? I mean, if you're talking now to people who are listening in, should this come from the employees? Should employers just make the first move? Who needs to make this first move to just create this muscle of courage and really get the conversation going?
I think when I started, it was very much you had to do it yourself, but that's a very different time and a very different environment. We do now have in diversity and inclusion, wellness and well-being, all of those programs in organizations now that we can use to create the safe space for people not to have to be quite so courageous, but yet, you know, to have the opportunity to talk. It's something I always encourage people to do. Have you ever had a conversation, just a simple conversation over a cup of coffee? Drop it in, start talking about it on a lower level and explore. Maybe you actually will find that the person sitting opposite you also has migraine. It's a high possibility, or knows somebody in the family who has it. So you can't say that there's one particular approach, but I do think that the environment we work in now and those programs often give opportunities. And now that employers hopefully on this call are listening, they also have the opportunity to say, gosh, you know, this is what we explored this week. And this week we've learned that migraine is a lot more complex perhaps than we thought. Is anybody interested in having a lunchtime meeting to have a chat and share experiences and develop from there?
Thank you. Maybe ask Mary and Leo to come in, and we can have a discussion between the three of us, and see. Deirdre will let me know if there's any questions coming in the chat, if there's anything pressing at the moment. If not, I just wanted to bring something else up again, and apologies, because when the world went dark for me, I missed most of Leo's presentation, which means forgive me if I'm asking a question again. But Claire, you also spoke about how you were on the focus group for Novartis designing this program. And perhaps Leo as well might come in on this and say how important that is, that there's no assumptions made about, well, look, we've read a pamphlet and this is what migraine patients need in the workplace, so let's do this, this, and this. But perhaps you could speak a little bit more about how important it is that migraine is so individual, and how important it is to actually have someone who's living with migraine to co-design a wellness initiative.
Yes, so for, I think Claire was referring to the leaflet that was shown at the very end, which is part of the basic educational campaign that is freely available to all employers in Ireland. However, you're referring to a very important point. You cannot design a patient support program without consulting patients, which sounds completely obvious, but very often in medical practice, we might not do that. So, but in this case, what we have done really is, once we had this moment where people were voting with their feet and showed up in hundreds in this Lunch and Learn event, we actually invited people to come to focus groups to discuss in a first step what migraine means for them working at Novartis. And then we asked them as well in terms of what could be potential helps we could provide to them. And I think one of these potential helps actually was that when you see a lot of, you will always find patients, some of them have read everything about migraine, and they probably know more about migraine than any professor of the world. But some of them actually might know very little, but even those ones knowing a lot sometimes then struggle as well with very human factors, starting even when you live with migraine, that you might not even have a person that really understands you what it means in the daily life. So that's why we then actually started designing this program, and where we said, look, on the one hand side, we need to leverage digital measures because there is cost restrictions to this. But at the same time, we want to ensure an human empathy factor as well, and human intelligence as well. We said we want to have lifestyle options included as much as medical options as well, as because we have learned before. And that we thought as well, we need to kind of shape the environment as much as we want to support the individual. So these were then all insights coming out of these focus groups that we had, and that we then used them basically as well as reference groups. So every time we kind of achieved the significant milestones, we went back to them and said, look, do you think this would be adding value for you in the situation that we have?
Super, thank you, Leo. And Leo, again, apologies, I did unfortunately miss your presentation. I know that you've published on this. Did you mention that publication in your presentation?
I did not. Thank you for reminding me. So this whole project indeed was a couple of weeks published in the journal Headache. Headache is kind of the leading scientific journal of pain in the head and in the face. And yes, so you can read it up there. It's freely available on their web page. And again, if you have an increased interest in learning exactly what was done and you want some more materials, it's our commitment as Novartis that we share all these materials, so that if you want to kind of copy paste the program and build it in your own environment, then you have a great start.
Thanks, Leo. Actually, I did read that paper. I thought it was fantastic. And so if anybody wants a copy of that or a link to it, because it's open access, which is wonderful, you can email us, and I'll also put a link to it. I did already, but I'll do it again on our Twitter page. Leo, again, apologies if you've answered this question, but is it my understanding that this program is at the moment only in Switzerland, in Novartis Switzerland?
The program, as it is described in the headache publication, and where we have these very scientific data generated, because Novartis is an evidence-based company, so of course we want to generate this evidence around this project, is available in Switzerland. It's available in Switzerland in the meantime by external providers who actually offer it to other companies, and we're having in the meantime a dozen other major companies purchasing the same type of integrated disease management to their associates.
Oh, very
similar programs are available in similar pilots were conducted in other Novartis organizations in the different countries. So I can refer to Ireland, our Irish Novartis Ireland, not only these educational materials, but they have worked out a rapid referral triage. So kind of if you're an associate in a company, and very often getting access to a headache specialist might not always be that easy, or you might not even be aware that such headache specialists might exist. So there is a pathway that actually how when you work for Novartis in Ireland, you can, through their partners in the well-being area, can access to a fast assessment that then kind of does a triage in terms of who is the best person to help you, and then you're kind of being facilitated in the access to the specialist as well. And I think if another company here on the call might be interested in this, then definitely it's worth reaching out to the colleagues at Novartis in Ireland. I have to open a bracket here due to Corona, access of private clinics and all of that. It's not always everything as it used to be, but fingers crossed, and in a couple of months we are back to normal.
Thank you. So Claire, I might actually bring you in for this. I'm thinking there may be some people who are on this call saying, well, that's fine for a big organization like Novartis that have a lot of resources and they've got the budget that they can do this. But, you know, I'm stretched to the limit. I have a very, very small team that I'm working with, and I just don't have the resources. What would you say to them, Claire or Leo, or both of you?
Well, for me, it's all right to start small. It's all right to start, and starting is the important bit. So it's to maybe have that conversation, you know, facilitate the conversation. Say that you're going to have a cuppa with a chat over whatever the internal video conferencing is at the moment, seeing as how most of us are fortunate enough to still be working, and they're working at home. And just open it up for a chat. See if you can find somebody who's a little bit more willing to have a chat about their experience. You know, I share my experience when I do these things. I'm lucky I can kind of flex between being a parent, being an employer, being an employee, you know, manager and employee. But really, it's just important to have somebody who's willing to go, migraine is there, it's horrible, it stinks, and it affects me. How does it affect you? How do you feel? And, you know, I feel rotten. You know, I'm lucky I can tell stories. So, you know, in one of my organizations, I was coming down with a really, really bad migraine. I needed my husband to come and collect me, and the team knew what to do. So they found an environment where they could isolate the lights. Not easy in this particular building. So they found a filing room and put me on a chair, wheeled me into the room, and then sat outside the door to protect me from the people who would inadvertently open the door and go, oh my God, there's a human being in there in the dark. So it's just to be able to start the conversation. After that, it will gather momentum, and hopefully, you know, the company will find somebody like yourselves to come in and add to the chat by giving real facts, real direction, some indication of, you know, specialists like Mary who can have an interest in headache, who will look at it from a GP perspective, and then on through the path, if necessary, to headache clinics like BOMAT.
Mary, sorry. Claire, Thank you so much. That's really great. I feel like there's a whole slogan there. It starts with a cuppa and a chat. It starts small. I love that. And thank you again for reminding me. And our regional development officer, Clive Armstrong, has also reminded me to remind you that at Migraine Ireland, we are able to come to your organisation, obviously not physically come in, but we can certainly do a virtual presentation. Technology allowing, to speak to any employers, and we can certainly work with you on that. We really encourage you to get in touch with us and to let us know what your requirements are, and work with us, please, and let us work with you to develop these migraine friendly initiatives in the workplace. Mary, I'm really conscious because I'm praying that my phone stays okay for me. So I'm conscious that I can't see you. But is there anything that you would like to, we're kind of coming towards the end now. And I suppose maybe I'd like to ask each of you in turn for maybe just one key takeaway, one thing that you would really want people who are listening in on this call to take away. So perhaps Mary, we'll come back to you.
Well, I'm going to take Leo's takeaway that he gave in the middle of his presentation. And he said, it's about lifestyle and medication, and maybe a chat with Migraine Ireland. And I'd just like to say to the audience that Migraine Ireland, or our Migraine Association of Ireland, identified a need for education of general practitioners, which was the initiative for me doing the document. And we had Migraine Association of Ireland review the document and patient input. My only downside is it wasn't particularly written in a plain language form. And this is the hope for my current document and for the update of the Migraine one in the future.
Mary, thank you. And thank you for all that you're doing to just create more understanding and to give hope. I'm going to come back to that again, to give hope, because there is hope. There is hope.
There is hope, yes. Yeah.
Thank you. Thank you so much, Mary. Leo, actually, I did get a question. Mary had mentioned in a presentation about the Migraine Buddy app, and I did get a question here to say, is that associated with Novartis?
The Migraine Buddy app is from an independent startup based in Singapore called Healint. We are working with them on certain projects, but we're not associated, or they're not dependent, they're independent from Novartis.
Okay, thank you for that clarification. Thank you, thank you. Leo, what perhaps Mary has stolen your takeaway perhaps, but is there one thing that you would like people to take away from this presentation? Just one sentence, one thing that they can do. Perhaps maybe what one thing can they do when they come off this call, this seminar?
My key takeaway is start being sensitive about migraine. Migraine is everywhere around you. And very often we are just too ignorant to see it. And so was I. I'm one of these Saulus to Paulus stories. I didn't see migraine. I didn't think it was an issue for the longest part of my life until I became sensitized. And once you sensitize it, then then people will come to you. I know so many people living with migraine that I know for many years, and they told me only 2 years ago that they would have migraine because I was not approachable for it. And if you do that, that's the first step, and everybody can do that. You can be that friend with your drinking buddy. You can be that friend to your colleague. You can be that open everywhere. And if you're in a leading role in a company, turn the question around. Don't wonder whether you can afford to do something for people living with migraine. Can you afford not to do something for people living with migraine? When it shows you the loyalty that you gain, when it shows you the return of investment and the pride you generate in your organization, it can be a major platform for you to achieve many of your culture and as well health and even financial objectives.
Thank you, Lee. That's very powerful. That's extremely powerful. Thank you. Thank you so much. And we really appreciate you taking the time to share the learnings from the migraine, the initiative, the wellness initiative. So thank you.
My honor to be with you.
Thank you so much. Claire, I'm going to thank you. Thank you so much. We so appreciate it. Claire, I'm going to come to you, and I'm going to leave the final word to you. Although I don't know if you can improve on just having a chat and a cuppa, but let's see. Is there anything in particular that you would like to just finish this conversation with?
I've 2 points to make, if I may. One, I want to recognise the fact that we've had over 70 people join this call, which therefore means quite a few of them may suffer from migraine. If you do suffer from migraine, a number of the things that we've discussed here are really key. One of the things I want to remind people about is Mary's point about diaries. Don't take them lightly, they're really important. Make it easy though. And whilst paper diaries are fantastic, and many of us are still in that era where paper diaries are much nicer than having to do something electronic, I use Migraine Buddy every day. It's really easy to use. It's like having a little friend in your pocket, because it kind of gives you a sense that somebody's keeping an eye on you and cares, because it's really well written, very quick to fill, and helps me when I have a conversation with my medical team. But from a sufferer perspective, talking to employers, I want to be my best self in work. It's really important to me. I do not want to be that presentee person who's just there suffering in pain, struggling to do my best. I want to do my best, and I want to feel that my employer is on my side and has some understanding and partners with me in that. I may not be a person in a wheelchair who has to be facilitated in those type of manners, but I have a disability. I have a disability that doesn't take a lot to support. And it's worth supporting, because I can give so much more when you help me that little bit.
Another very powerful testimony. Thank you so much. Thank you to Mary, to Leo, to Claire. I have to also say thank you to my colleague Deirdre, who was my wing woman when technology failed. So once again, sincere apologies for my technology disaster. This will be recorded. I hope you will be kind and ignore all the things that went wrong. And really, I'm sure you will, because you'll focus on these three incredible presentations that we were, in the Migraine Association of Ireland, extremely honoured to have the three of you speak today, to give your time. I'm sure you'll agree that it was incredibly powerful. So I'm going to end today's session. Again, thank you also for attending. And as Claire said, the fact that you showed up in such high numbers really shows that you do care. You care about what it's like to work with migraine. So just one last thing to say is, please do feel free to email us at info@migraine.ie. And yeah, please follow us on social media as well, on Twitter and Facebook at Migraine Ireland, and we will be sharing these slides. We'll be sharing some more information. So once again, thank you so much. It's a bank holiday weekend here in Ireland. I'm not sure if that means anything to us anymore in lockdown, but I wish you all a very safe and a lovely bank holiday weekend. So thank you again, and thank you especially to our three wonderful speakers. Thank you.
Bye and good luck.
Bye-bye. Have a nice long weekend, everybody, and stay safe. Huh?
Thanks.